Canada is seeing a surge in the respiratory virus RSV across the country as the weather gets colder. The virus causes common cold symptoms, but it can be serious. Children are at the greatest risk, but there are concerns that it could spread from children to vulnerable seniors. And healthcare workers fear a combination of RSV, the flu, and COVID-19 could bring about a triple virus season. For more on this, Dr. Samar Gupta joins me now. He's a respirologist and associate professor in the Department of Medicine at the University of Toronto. Welcome.
Thank you, Charles.
So this spike that we are seeing, or I guess I should ask, are we seeing a spike right now? Because there is this fear of this triple threat combo.
Yeah, we've heard about this triple threat idea throughout the pandemic. I would say that what's important is that probably and hopefully this will be the first since COVID, the first respiratory viral season that's kind of on track, that's normal and as expected. Whereas previously we had these viruses spiking at unusual times. Because of restrictions and opening up at various times and the population being susceptible. So we're seeing kind of the increases we expect. We are seeing more RSV than usual, so this is the RSV time. Flu is kind of at seasonal average if you look at pre-COVID years. And COVID is variable across the country. There's parts of the country where it's increasing, there's parts where it's flat or going down. And so we'll see if COVID falls into the seasonal pattern. But what's important is our hospitals haven't sort of been hit by an unusual, last year we had a late summer RSV surge. So we're kind of ready for the respiratory viral season. And if we get hit by all three, hopefully we can manage that. But it'll hopefully be a more typical season for us.
Yeah, well, I was telling you, as we were in commercial break there, that last year I had COVID, I had influenza, and I had pneumonia. So, and I was in the hospital for 10 days, and luckily I got better. But if you get one of these viruses, are you more susceptible at getting the others?
Well, what you describe can happen, and it's, first thing is co-infection. You can have two of these at the same time, and the studies do suggest, and we don't have a lot of data, it's uncommon, but the studies suggest that having two is worse. People have worse outcomes. The other thing is what probably happened to you is what we call a super infection, where you have the viral infection. It affects our immune system. It also physically affects the respiratory tract. And because of that, we become more susceptible to a bacterial infection. So you have the virus, then you can get a bacterial pneumonia, or kids can get bacterial ear infection. And so this is often how people get really sick after these viruses.
Which is why I had to go on antibiotics. So, okay, so how do you determine when you're having all of this happen, if you have one, if you have two, if you have all three, and if you should treat them differently?
Yeah, I mean, it's too bad we can't easily test for all three. There are test kits out there for that. Most people have a COVID test. Really, I'd say the only way to tell is to test. They're very similar. These are respiratory, they affect the respiratory tract, upper and lower. Couple of things I'd say might clue you in. COVID, more likely to be COVID if you've lost your sense of taste and smell. In kids, RSV causes wheezing, that's sort of distinguishing. That severe body aches and pains usually is flu, can be COVID as well. Just those things, but really these are going to be very similar viruses.
Okay, so I guess which leads me to my next question. It is vaccine season. Can you get vaccines for all three? Can you do that at the same time? Are there interactions?
Yes, great question, and thank you for that, because this is the first respiratory viral season where we do have vaccines for all three of these. That's because RSV is new. The RSV vaccine is new. We have a new COVID vaccine that's tailored to the current variants, the XBB family variants, and sort of these are offshoots of Omicron. So if you haven't had COVID in the last 6 months or a COVID shot, good idea to get that new COVID vaccine. Of course, we have a flu shot like we do every year. And now for people 60 plus, we have this RSV vaccine. And this is new, and it's very effective. It's only for people 60 plus, and this one's not covered by the government, so people have to go out and pay for it.
Is it expensive?
It's in that $200 to $300 range by the time you get it, and then get someone to administer it, whether it's a doctor, nurse, pharmacist. But what we're looking at is an 83% reduction in lower respiratory tract RSV, 94% reduction in severe RSV. So, out of the big three, this is number three, but it's still an important one. People still get sick from it. So still a very effective vaccine for people to go out and get.
So it might be worth the investment. Here's a question for you. Can you get a vaccine when you are sick, or do you have to wait till you're kind of, okay and fully healthy to get the vaccine?
It's a great question. We generally like people to have recovered from a viral illness before getting their vaccine. A couple of reasons for that. The other thing you mentioned is about what can you get at the same time. You can get flu and COVID at the same time. Generally, we like to space out the RSV vaccine, but 2 arms, flu, COVID, you can get that. And that's often just a practical way to get 2 vaccines out of the way.